The adrenal glands are a part of the endocrine system. As you can see in the picture, there are two glands that sit on top of the kidneys, giving it a little bit of cushion. The adrenal glands are responsible for producing a steroid hormone known as cortisol. It is released in response to stress and low level of blood glucose.
And speaking of Cushing, today we're going to discuss a little bit more about the Cushing syndrome.
Before we get into it, can anybody tell me what is Cushing syndrome? Cushing syndrome is defined as the sign and symptoms associated with long-term exposure to inappropriately high levels of cortisol. The most common causes of Cushing syndrome are exogenous and endogenous.
Normally, the production of cortisol follows a precise chain of events. First, the hypothalamus, a part of the brain, sends corticotropin-releasing hormone, also known as CRH, to the pituitary gland. CRH causes the pituitary to secrete ACTH, which is also known as adrenocorticotropin, a hormone that stimulates the adrenal glands. When the adrenals, which are located just above the kidneys, receive the ACTH, they respond by releasing cortisol into the bloodstream.
Cushing syndrome can develop from a cause that originates outside of your body, known as exogenous Cushing syndrome. Taking corticosteroid medications in high doses over an extended period of time may result in Cushing syndrome. These medications, such as prednisone, have the same effect as does the cortisol produced by your body.
Doctors may prescribe corticosteroids to treat inflammatory diseases such as rheumatoid arthritis, lupus, and asthma, or to prevent your body from rejecting a transplanted organ. Because the doses required to treat these conditions are often higher than the amount of cortisol your body normally needs each day, the effects of excess cortisol can occur.
The condition may also be due to your body's own overproduction of cortisol, also known as endogenous Cushing syndrome. This may occur from excess production by one or both adrenal glands, or overproduction of the adrenocorticotropin hormone, also known as ACTH, which normally regulates cortisol production. In these cases, Cushing syndrome may be related to a pituitary gland tumor, an ectopic ACTH secreting tumor, a primary adrenal gland disease, or inherited familial Cushing syndrome.
This is Beyonce Knowles, a 23-year-old female pop singer. As you can see, she is performing daily activities such as watching TV, getting a glass of water, and reading her book. This is her before Cushing syndrome.
Weight gain is the most common feature and results from accumulation of fat tissues in the trunk, facial, and cervical areas. They can be described as truncal obesity, buffalo hump, which is the fat in the back of the neck, and the moon face, which is roundness and fullness of the face. Patients can gain 20 pounds within 2 weeks.
Loss of protein leads to osteoporosis with pathologic fractures. Catabolic effects of cortisol will lead to protein wasting, leading to muscle wasting and weakness, bone and back pain, kyphosis, and reduced height.
Loss of collagen leads to thinning of the skin. These changes account for the characteristics of deep purple striae, also known as stretch marks, on the abdomen, on the breast, and on the buttocks.
Loss of collagen support leads to easy bruising, skin breaks, ulcerations, brown hyperpigmentations, and flushed cheeks.
Females may develop high androgen levels, increased hair growth, especially facial hair, and infrequent menstrual periods.
Approximately 50% of individuals with Cushing syndrome experience alterations in their mental status. That ranges from irritability, insomnia, depression, and severe psychiatric disturbances, such as schizophrenia. 20% of those suffering from Cushing syndrome will develop overt diabetes mellitus. Elevated cortisol levels also lead to hypertension, sodium and water retention, and hypokalemia. Suppression of the immune system leads to increased susceptibility to infections.
Current diagnostic studies include history and physical examination, mental status examination, plasma cortisol and plasma ACTH levels, complete blood count with white blood cell differential, blood chemistries for sodium, potassium, and glucose, dexamethasone suppression test, a 24-hour urine sample, and a CT and MRI scan.
The primary goal of treatment is to normalize hormone secretions. The specific treatment is dependent on the underlying cause. It includes medication, radiation, and surgery. Differentiation between pituitary, ectopic, and adrenal Cushing syndrome is essential for effective treatment. For example, if the underlying cause is pituitary adenoma, the standard treatment would be surgical removal of the tumor. If not successful or contradicting, then eradication of the tumor may become necessary. Laparoscopic adrenalectomy is used to remove adrenal tumors, unless a known or suspected malignant adrenal tumor is present.
Drug therapy is used when surgery is contradicting or along with surgery. The goal of drug therapy is the inhibition of adrenal function. Drugs that inhibit corticosteroid synthesis include ketoconazole and aminoglutamide, but these drugs should be used cautiously because they are often toxic at doses needed to reduce adrenal function. Without treatment, approximately 50% of individuals with Cushing syndrome die within 5 years of onset as a result of overwhelming infection, suicide, complications from generalized arteriosclerosis, and hypertensive disease.
Your assessment should consist of both subjective and objective data. Subjective data should include any past health history of pituitary tumors, adrenal, pancreatic, or pulmonary neoplasms, GI bleeding, frequent infections, and also the use of corticosteroids. When obtaining objective data, observe the patient for truncal obesity, supraclavicular fat pads, buffalo hump, and moon faces. Also, assess for facial hair and body hair, thinning of head hair, thin, friable skin, acne, petechiae, purpurae, hyperpigmentation, purplish red striae on breast, buttocks, and abdomen, and edema of lower extremities. Obtain blood pressure to assess for hypertension. Observe for muscle wasting, thin extremities, and awkward gait. Check for gynecomastia, testicular atrophy, or enlarged clitoris. Nursing diagnosis for the patient with Cushing syndrome may include, but are not limited to, risk for infection related to lower resistance to stress and suppression of immune system, imbalanced nutrition, more than body requirements related to increased appetite, high caloric content of foods, and inactivity, disturbed self esteem related to altered body image and emotional reliability, impaired skin integrity related to excess corticosteroids, immobility, and altered skin fragility.
The overall goals are that the patient with Cushing syndrome will experience relief of symptoms, have no serious complications, maintain a positive self-image, and accurately participate in the therapeutic plan.
Before surgery, the patient should be brought to optimal physical condition. Hypertension and hyperglycemia must be controlled, and hypokalemia must be corrected with diet and potassium supplements before surgery. Preoperative teaching will depend on the type of surgical approach planned. For both laparoscopic and open adrenalectomy, patients may have a nasogastric tube, a urinary catheter, IV therapy, central venous pressure monitoring, and leg sequential compression devices to prevent emboli. The critical period for circulatory instability ranges from 24 to 48 hours. Blood pressure, fluid balance, and electrolyte levels tend to be unstable because of hormone fluctuations. High doses of corticosteroids, such as hydrocortisone, are administered intravenously during surgery and for several days afterward to ensure adequate response to the stress of the procedure. Monitor any rapid changes in blood pressure, respirations, or heart rate. Monitor fluid intake and output and assess for potential imbalances. Keep the IV line in place after corticosteroids are withdrawn to keep a line open for quick administration of corticosteroids or vasopressors. Obtain morning urine samples collected at the same time each morning for cortisol measurement to evaluate the effectiveness of surgery. Report signs and symptoms so that drug doses can be adjusted as necessary. Vomiting, increased weakness, dehydration, and hypotension may indicate hypocorticolism. The patient may complain of painful joints, pruritus, or peeling skin and may experience severe emotional disturbances. After surgery, the patient is usually maintained on bed rest until the blood pressure stabilizes. Be alert for subtle signs of postoperative infections because the usual inflammatory responses are suppressed.
Consider a visiting nurse referral, especially for older adults, because of the need for ongoing evaluation and educational needs. Instruct the patient to wear a medic alert bracelet at all times and carry medical identification and instructions in a wallet or purse. Teach the patient to avoid exposure to extremes of temperatures, infections, and emotional disturbances such as stress.
The expected outcomes are that the patient with Cushing syndrome will experience no signs or symptoms of infection, attain weight appropriate for height, report increased acceptance of appearance, and demonstrate healing of skin and maintenance of intact skin.
Yeah. Yeah, yeah. Yeah, yeah. Yeah, yeah. Yeah, yeah.